So another symptom of acute abdomen, if a patient is having sudden abdominal pain, is actually fever and chills. All right. So the patient will be having some fever and chills. All right. And this is the concept we're trying to look at. Look at the definition. Look at the fever. Then we'll look at the chills or rigors. Okay. Um, look at what association. All right, like the association, like if the patient is having rigors and chills and fever, you know that this acute abdomen is associated with some particular conditions, right? So let's look at it. We see that the fever and chills, stroke rigors, are common symptoms which are seen in acute abdomen, okay? And when you see them, it indicates a potential infection or inflammatory process that is going on. All right. So talking about a fever, fever is when the body's temperature is elevated, generally above 38 degrees Celsius, or if you convert it to Fahrenheit, to say that it's basically 100.4 degree Fahrenheit. Okay. So when there's fever, it indicates what? An infection or inflammation. Okay. And the fever now could be caused by what? Basically, when you see fever in the patient that is complaining about acute abdomen, you start suspecting things like what? Bacterial or viral infection. And this could be possibly due to an underlying appendicitis, cholecystitis, or diverticulitis. Okay? Then, if it is an inflammatory condition, you'll be suspecting things like what? It could be pancreatitis, it could be inflammatory bowel disease. Okay? They're talking about the chills and rigors. Chills and rigors is basically the same thing. It's just you feeling cold or shaky. Okay? Can you see this guy? Can you see all this lightning? Okay? Could be that, yeah. There's pain, the guy is shaky. Can you see that this guy is feeling cold? He's covering all this blanket and all the stuff, right? So this is a prominent symptom that is seen in acute abdomen. So feeling of coldness and shaking, and this is often accompanied by what? A fever spike, okay? So if you are feeling cold and shaky, it indicates that there's a severe response to an infection or inflammation, all right? And it's mostly caused by what? Bacterial infections like pyelonephritis or sepsis. It could be viral infections like viral gastroenteritis, and it could be inflammatory conditions like what? Acute pancreatitis. Okay. So in acute abdomen, fever and chills could be associated with various conditions like what? Like the underlying cause. It could be appendicitis, it could be cholecystitis, it could be diverticulitis, it could be pancreatitis, it could be pyelonephritis, it could be peritonitis, it could be intestinal obstruction, it could be inflammatory bowel disease. Okay, and my professor actually added some for me here, which I would like to give you guys. It could be as a result of a perforated hollow viscous. It could be that what? Some part of the intestines got perforated. It could be that there was what? An amoebic liver abscess. All right. It could be that there's a pyogenic liver abscess. Okay, that means like there's pus in the liver. All right. This one is basically what? The liver was infected by the enter-amoeba histolytica, and this led to formation of abscess. All right. It could be as a result of perinephric abscess. It could be as a result of what? Intra-abdominal pus collection. All right. So that's it about what the chills and rigors that could actually be seen in acute abdomen.